All right. Good morning, everyone. And thank you for joining us today in our 59th installment of EO Exchange Series. This series has been so valuable for all of us, and it's been great to have our partners be subject matter experts on such important topics. To close this series, however, we're actually going to hear from two of our members as we explore critical aspects of healthcare, financial planning, and lifestyle choices that can help ensure you and your loved ones are well provided for without becoming a burden. Before I introduce our speakers today, it's important that we are able to get feedback and suggestions through the survey links that we provide after the exchanges. So please take a few minutes and fill out the survey and let us know how we're doing and what we need to be doing differently. So to introduce our members today, I'm going to start with board member and current SAP chair, Chris Guay. Chris is the founder and CEO of Vitality Living, which provides senior living communities throughout the Southeast and parts of Texas. Chris has over 20 years of operations, management, and leadership experience in the senior living industry. Before founding Vitality, Chris served as Brookdale's Northeast Division President, overseeing 275 communities across 18 states. He is dedicated to creating a company that engages residents, families, and associates in successful aging. Elizabeth Moss is our other presenter today, and she is the founder of The Art of Care, a holistic approach that seamlessly merges intuitive wisdom with enlightened intellect designed to empower women, caregivers, and business leaders to cultivate routines of self-care and self-love, extending this nurturing ethos to those they support and guide. A pioneer in the field of caregiving, Elizabeth has over 25 years of experience in mastering the balance between caregiving and self-care. Her previous company, Caregivers by Whole Care, transformed in-home care from a simple sitter service into a compassionate art form that honors the whole person. She now serves as a certified coach in Clarity Catalyst, Directing Your Destiny, and Conscious Ketamine Coaching through the Art of Care. In this session, we will cover long-term care, paying for services, private pay versus insurance, in-home care versus senior living options. So Chris and Elizabeth, thank you so much for joining us today, and it is all yours.
All right. David, thank you for the introduction.
Thank you, David.
All right. Elizabeth, I'll kick us off. Everybody can see our screen. We really wanted to take an approach to share information and then hopefully educate and create thoughts around aging and what the process looks like. The exchanges prior to this were kind of how do you age healthy. We're really taking a step of how you protect your parents' future and your future as you think about as people are living longer. And so I'm a big believer in stats. So first, just read, David went over this, but reiterate, talking about long-term care, understanding the types available versus home, in-home, independent, assisted living, nursing home, et cetera. Paying for services, private versus insurance, and then in-home versus senior living options. But we are an aging population. And actually, this is Elizabeth's quote that she brought in. And so, Elizabeth, I'm going to let you kind of speak to this quote really quickly, because I think it's a profound one and sets us up for this exchange.
Yeah, it is pretty profound. And Rosalind Carter, all those years ago, when all the baby boomers were babies, said this: there are only four kinds of people: those who are currently caregivers, those who will be caregivers, those who have been caregivers, and those of us who will need a caregiver. And 70% of us will need some level of care. And I think the challenge is that so many family members don't identify themselves as a caregiver. And in essence, they really are. So it's important to, whatever you're doing for your parents in their inability to do things for themselves, you really are a caregiver.
So the why behind this quote, why I think it's so important today, is we are an aging population. And I'm a big believer in understanding the data. And so if you look over the last 20 years, people are living longer, right? We know all the reasons. People are getting healthier. Medicine is getting better. Diseases are getting more understood. People are taking better care of themselves. Just if you look at how many people smoke today versus 20 years ago. The other factor is just generational. And this is the effect and the impact of the baby boomers. And this slide demonstrates kind of the uptick of where our aging population is going. And there's some pretty profound stats in here. And so when you look, the baby boomers are kind of what they're also termed now as that silver tsunami. And in 2030, 1 of every 5 Americans will be over 65. They'll be the largest cohort of over 65 in this country's history. For the first time in this country's history, by 2034, the 65 plus population will outnumber the 18 and under population. It's never happened in our history. And then when you look at 2040, the 75 plus population will more than double from 2016. And all of that comes to that time back, post World War II, where American GIs came back and they all had families, right? And so that generation is starting to age in. And so we've got this flux of two things happening, just general health getting better, but then also a generational piece. So this aging issue and this aging piece is now, like many of us right now, have aging parents starting to affect our parents. And then some of us will have to start thinking about it. People are living longer. Healthcare advances dramatically extend the life expectancy of Americans. By 2060, life expectancy population is projected to increase 6.1 years, from 79.5 to 85.5. Again, all those pieces pushing through. And so we've got to think how we all have to be preparing for how are we going to age and what's our plan as we age beyond 75, right? The thought of thinking now that you're going to retire at 65 and 70 and go maybe 10 years is not a reality. Now people are living 20, 30 years beyond that. 2019, average 75-year-old is expected to live an additional 11 and a half years, taking them to that 85 for women or for men, and then 13.1 years for women. Women tend to age better than us. I think they're a little bit smarter, so they live a little bit longer. The other piece of aging is the increase in cognitive issues. And so a lot of people kind of use the term Alzheimer's and dementia, but you can really bucket that umbrella into any kind of cognitive disorder, anything where memory loss and things of that nature. And some of you, I'm sure, many of you on this exchange had a loved one or have a friend or know someone who has been impacted by Alzheimer's or dementia. But this is a very large growing segment of our population. Again, for all the reasons we just talked about. Alzheimer's dementia, in my opinion, my hypothesis has always been there, but 30, 40 years ago, you said grandpa was senile. Now we're seeing people live longer, and it's just a form of aging. Now, there's a lot you can do. That's a whole other exchange of how you can stave off the effects of cognitive decline. But as we look at that group, more than 6 million Americans are living with Alzheimer's today. By 2050, that number is more than double at 13 million, which is a huge increase in a short period of time. By 2050, 15% of adults at age 65 or older are forecasted to have Alzheimer's. Now, that makes me go back to what I said earlier. We need to all be smarter in how can we prevent that, but it is a huge disease. People living with Alzheimer's or other dementia have twice as many hospital stays per year as older adults. That is very important as you think about your aging parents and others when you start thinking about having a plan. That stat's really important because hospital visits tend to lead to an increased decline in healthcare. You can just see the stats. Hospitals don't really do much well for older adults. It's really what you do before they get to the hospital that can make a huge difference on life. Need for care, very fast growing. That's why Elizabeth and I are, I always say I got lucky, I landed in the right industry, but we have people that need what we're doing. Approximately 21% of seniors over the age of 75 will have an ADL or IADL to require personal care from others. And all ADL is an activity of daily life, meaning 21% of people over 75 will need help from somebody to just live normal daily life activities, things that we take for granted, taking a shower, going to get our groceries, just walking our dog. And so they'll need help with that. Assuming a constant percentage of help needs, by 2030, over 5 million 75 plus individuals require some form of personal care from others, right? It's that need to have someone else care. And in traditional settings or historically, in a lot of different countries, culturally, it's the family's job to lean in, but not all of us have that ability to do that. And so what are the other options? We're going to talk about that. And then the ratio of 85% plus population for 100 individuals aged 20 to 64 is expected more than double in 2040. We talked about that earlier. So you've got just this kind of need. And so it creates this gap. There's going to be a lot of need for additional care. And so understanding what the options are and understanding what is out there for your aging parents or grandparents or whoever, but then also thinking about yourself, I think are going to be important. And this is just demand chart. There's going to be a major shortage for supply. And all that, I wanted to share this because There's not going to be enough senior housing and supply out there to take care of everybody. So we're going to have to find better ways to care for older adults, whether it's at home or different options. And I think that's really important. And so it's really, to me, this part of the presentation is you got to understand the data to really see what the issue is in front of us, so we can start all thinking a little differently about it. And so at that point, this point, I'm going to turn it over to Elizabeth to talk a little bit about home care and senior housing, what it is, and how we think it can be a real part. It should be a part of every older and aging adults plan going forward.
Okay, so what is the reality of all of this? What does all of that data really mean for us individually and our loved ones? First of all, 95% of seniors want to live in their own home, and this metric went up 5% after COVID. So people who were in communities, now when I say home, this means wherever they are. This is home. It doesn't mean a specific place necessarily. However, people who are in their homes and have raised their children in those homes typically want to stay there. There are situations they cannot stay there, and some people want to move into a socialized community where they can be with their peers. And you can read these reality checks, and there's a lot of things. I think the face on this gentleman says a lot, that, you know, Medicare, it's an assumption that Medicare, because it's healthcare, pays for long-term care. It does not. It pays for episodic care, whether that be in the hospital, whether it be in skilled nursing communities, or whether it be at home with physical therapy, occupational therapy, nursing, so forth. It is short-term, 2 to 3 days a week, and 45 minutes a visit at best. So it's important that people do remember that when there has been a hospitalization, or even Medicare comes into the home to provide physical therapy and those other services, if there's a need for strengthening. And yes, that's what it pays for, but the extended care, Medicare does not pay for. So back to one of these statistics.
Okay.
Oh, wait a minute. Yeah, according to the census data, by 2050, 1 in 4 people 65 and older are likely to live to 100. And that is mind-blowing, really. I think the average age today it's grown, but it's 83, I think, for women. And so, yes, next slide,
A little
please.
younger for men. Yeah, and I'll just add to that, if you think about that, not many people, I know, like my grandfather didn't plan to live to 100, he lived to 98. So it's, as you start to think about the plan for your parents and yourself, really starting to think about, what do I have in place for them and for myself if we were to live to 100? And I think the piece that Elizabeth just said is really important. People make assumptions that Medicare pays for more than it does. So understanding what is paid for and what not is critical to planning long-term.
Correct. And another little story about my own personal situation. My mother, I knew she was going to need care, and I knew she didn't have the resources to pay for that care. I actually went to my grandfather, who did have resources, to ask him if he would help me pay for a long-term care insurance policy for her. Now, his comment back to me was very surprising, but the situation, I think, is important to realize, which is she would either be wealthy or she would be indigent. Either way, she was going to be taken care of in his perspective. Well, he lived so long, to 93, she didn't get to experience any of that passed down wealth. He died 1 week, she died 2 weeks later on the same day. So that wealth, she didn't experience it, and she was indigent, but I was the one responsible that had to support her financially for that care. So those who live to 85, and if you live to 65, you have, I don't remember the percentage, but you have a high likelihood of living to 85. But it's the fastest growing age group we have now. So what does this mean for you? Next slide, please. So I think the most important thing to ask if the person has capacity to answer this question and to participate in a conversation is, what are their wishes? That is important so it preserves the relationship that's in place currently. This is a difficult journey to travel, and I feel sure that several of you on this already are experiencing this and realize the challenges that are that you face with this. But having that conversation early and being proactive is key. And then talking to each other, because all of us, we like to take charge. We're entrepreneurs, we are business owners, and we take charge. And we make plans and we create strategies for those plans, and we get busy implementing all of those plans. This requires a little more, to slow down, include the older adult, have the conversation, and really it's a negotiation process many times. I'm working with a client now who thinks she needs housekeeping only. She has dementia. She's 87. She lives alone, and she needs hygiene. She needs a lot of ADLs. And we're not going to try to convince her what she needs. We're going to agree with her that we get a housekeeper for her, and we are going to proceed with the rest of the plan. And then in small bites, she's going to accept it, in a friendly way, a little at a time. But what does the younger generation know? Do you have all the knowledge? This presentation is a good start for everybody to have some knowledge to move forward. And Chris and I have already said that if you want to have a separate conversation, or we can have a group discussion, we can do that following this. But think about these questions and have the conversation. Next slide, please.
Yeah, if I can just add, I want to really emphasize, start talking. If you have an aging parent or an aging loved one, start talking sooner than later about this. And I'll use my experience here. My grandfather, like probably about 90, he'd come visit me on Thanksgiving, Easter, and we would go tour a couple of my properties. We'd have the same ongoing conversation. He's like, I'm not quite ready, or maybe it's for me. And we'd redo this. And I just never gave up talking to him about it. And then when it finally got to the point where he needed it, we were able to have a real conversation. It wasn't about educating him or getting through the fears. We were there because we had been talking about it regularly. And so starting to have these conversations about financial plans, but healthcare plans include living plans, like what people want, and is it realistic? So you can be set up when the time comes. Because those of you that have been through having to find placement or find another living situation for an aging loved one, a lot of times it hits you and when you're not ready for it and you're scrambling. And so the more you can start having these discussions now and talking about these things up front, you can get through the emotions and the fear and the loss of independence and get through that, so that you're making a decision from a place of being informed and alignment versus reacting. It will make the process easier for your loved one.
Yeah, so to capsulize that, plan while you have the luxury of time, and then you don't end up in crisis management mode. So what are the communication barriers? We have found and hear from younger adults and family members that there is a trust component. Well, first of all, there's huge denial with the older adults that, to Chris's point, I don't need this yet. And the yet doesn't come, especially if there begins to be cognitive impairment issues. But trust is also a barrier, because the adult children, older adults, in my case, my mom still saw me as a little girl. Now, I've done this for 30 plus years, but in Arizona, things apparently were different to her than they were in Tennessee. It's really not the case, except some nuances to insurance policies and what the government pays for in specific states. But there was a component there. And then the fear of not being in control not knowing what's going to happen to them. All of these play a part. So there are trusted professionals, whether they be trusted professionals to your parent or loved one, like neighbors and friends, they can be resources for you. And any physicians and attorneys and CPAs and financial advisors, any of those roles are trusted advisors. That it's important to be brought in with your loved one early on for the financial and tax implications and all of these conversations sooner rather than later. And then there are people, and I act in this capacity. I am a consultant for families, can facilitate family meetings and so forth. So I'm a trusted professional. And then we have a nonprofit entity in Middle Tennessee, formerly known as Council on Aging, now Age Well Middle Tennessee, that is a great resource. They have a directory online and you can pull that. Next slide, please. And then to the point of ADLs, activities of daily living, and IADLs, independent activities of daily living. So what are those signs to look out for? Because there are red flags, but one of them might not raise the red flag for you. But when they start adding up, or the financial help is, rearing its ugly head, then it might be the leading factor. But all of these tend to be progression in their need for help. And so these struggles with activities of daily living, it's, hygiene, grooming, housekeeping, all of those things. And when there's cognitive deficit, they will argue with you about their capacity to manage these things. And because in their mind, they don't have a problem. They bathe every morning because that's what they did 5 years ago. But it could be a month since they've had a bath or a shower. And so these become major issues. Next slide.
I just want to highlight, just to really think if you're in these situations. The first one is isolation. What COVID really showed is social isolation for anybody of any age is really bad, but it showed a significant decline where we saw people, older adults isolated at home versus older adults isolated in a community-based setting did significantly worse, because not having that interaction with people is really, really, so if you're seeing a loved one start to isolate, trying to figure out ways to slow that or get them reconnected is the first step in helping them get healthy again. The next one I want to just highlight is falls. We all kind of think, oh, falls happen. We all stumble. I tripped walking out the garage the other day, right? And so it happens. But in older adults, this is a devastating stat, but people over the age of 75 who have a hip break, and right, they're usually more frail, they're more feeble, so it's easy to fall, land a hip, break it, who go to the hospital after a hip fracture, their death rate increases by like 68%. Because it starts this hard decline. And so if you can get ahead of some of this and start helping your older loved ones make better decisions or try to stay more active to prevent falling from happening, you can never prevent falls, but if you do things to make them less frequent, your likelihood of aging better also improves.
Or push out that bad fall, right? Do the strengthening exercise, the socialization and so forth. Yeah. So there is a danger zone. And so what this was a good segue. Pushing out the need for help, pushing out the need for a move, pushing out the need for or the injury, then we're able to improve that ability for independency longer. And anytime you have a decline in functional ability, then there's more help that's needed. So that functional mobility and functional ability is important to be very proactive with. You can see here that all of us, we don't have any functional limitations, and we're fine, and we're independent, and we might stumble, we might fall down or up the steps sometime. But because of our age and our health, it's not an issue. But when an older adult does that one time, it could be a major issue. It could be a crisis. It could be a hip break. It could be an ankle break. It could be any sort of incident that requires or that creates the limitation. And the more limitation there is, you can see along this graph that it leads to dependence on somebody, on a different living environment, and it can create financial crisis as well. So whether it be a family member that's the caregiver, that then it disrupts their life. I can't remember the statistics about adult children of aging people and time and dollars missed at work as a result of the need for caring for their parents, but it's an astronomical number. There's $400 billion of unpaid caregiving being provided by family members. That's huge. And so they're missing work to do that. So these functional limitations begin to take a toll on everybody. As you can see, there are some early services, adult day services, but the earliest intervention that I want to talk about is technology. So whether it's at home and your loved one has cognitive impairment, there are systems and devices that you can track that person to make sure they're not lost, that you can detect a fall, that you can detect lack of movement because it records the movement and the patterns of normal, healthy behavior. And when those patterns of movement are broken, then it alerts somebody. And so those alerts and getting attention sooner rather than later is imperative. If somebody falls, the likelihood of them getting to the hospital is necessary. They need to get there within a short period of time to get the interventions they need to have the outcomes improve. If they lie there for a period of time, a long period of time, I've had clients that laid there for 30 hours, then that's not a very good outcome. So we want to put systems, technology, and people in place so that we can prevent the worst case scenarios. You can see along this trajectory that the more dependence there is, then the higher the cost and the higher the need for full-time care. And so that's the danger zone. If we can put things ahead of that, then it prolongs the need for a move. It prolongs the need for 24-hour care. It prolongs the need for using their financial resources that they have saved, or hopefully saved along the way for these things. But the technology, so more specifically, even AirTags, like we have in our phone, we have tracking ability in our telephone. You can buy AirTags individually, and people put them in their loved one's shoes. You can put them in a backpack. You can put them in a briefcase. You can put them in the car. You can put it anywhere you want to help identify where that person is or the direction that they're going so you can intervene. There's a lot of technology companies. I'm testing a medication system right now, and I have intentionally missed the dose, so it's in there talking to me saying I've missed the dose, but I'm testing it to see who it's going to alert and how long it will do that. So management systems like this can help somebody who overdoses their medications or misses doses and with very necessary medications. And at the bottom of this, I've put a local resource, elder law attorney Barbara Moss, no relation to me, who's a great resource in our community. Next slide.
I just want to I'm just going to add a piece on the technology piece, Elizabeth. I think, obviously the business I'm in, I'm a proponent of getting people at the right time into community-based living. I think there's a lot of pros to that, but there's also a lot of folks that living at home is what they want, or that's their option. The technology piece, it doesn't have to be complex. You can go down a lot of technology rabbit holes. There's all kinds of tech out there to try to monitor what's going on. The largest group adopting technology right now are seniors, people over 65, right? Because they're the group that hasn't had that much technology. Simple things you can do. The AirTag is a great one. Getting your loved one an Apple Watch and doing the health features on it, right? Where you can track how much are they walking. And if you gamify it with them and it becomes something, and all of a sudden you notice, your dad, your mom, your grandmother used to walk 5,000 steps a day, and all of a sudden in the last 2 weeks they're walking 1,000. It helps you get some indications of maybe something's changing. And so you can use some of just the basic technology we use every day that a lot of us have been talking about in the last several sessions about helping our own longevity, and apply it and use it with our loved ones to help understand their health. There's several companies now that are doing telehealth-based medicine using an iWatch to stay connected, to understand, to read vital signs for people, and to help them manage their health from afar better. So there are several forms of technology, and like I said, you can reach out to Elizabeth and I if you have some concerns that you might be able to start using today at home. They may not solve the need for something more down the road. They're not going to be a cure-all. Technology will never replace good care from people, but they can start at least creating more information and getting you more information and your loved one more information to hopefully make more informed decisions or see something coming before it's too late.
Thank you. Yes, and so here's the continuum of care and who pays for what. And also the technology is on this slide. And you can see that the more we need in place, the more money it costs. And so private pay consists of, money you've saved for a rainy day. I will say that a lot of older adults don't recognize the storm that is imminent. And so they still save, and they're not using their resources for what they need today, like technology, or like having a housekeeper even, or have somebody help them go to the store. But all of that is private pay. Long-term care is also a private pay product. And so the earlier we can get that in place for ourselves, I'll share a little experience. The first time I got a long-term care insurance policy was at 45 years old. This is the world I'm in. I, could see the forest for the trees. And I got it for my then husband as well. Then for whatever reason, it lapsed and I didn't have it for a while. And when I went back to get a new policy, I was still able to get it at 50 years old, but at 54 years old, he was not. And it's because he had a COPD diagnosis in between that time, and he no longer qualified for long-term care insurance. So that's the risk we take. We wait too long. I think the other risk that Chris and I were talking about is there's an assumption around long-term care insurance that it is only for when we get older and need services and support like what we've been talking about. But there are young people who are diagnosed with, tragic diseases like ALS or MS, or there's a car accident, or, a multitude of reasons somebody might need long-term support. Long-term care insurance pays for that as well. So Susie Orman said, it doesn't matter what age you get it, you're going to pay the same amount of money. If you get it younger, you're going to pay longer. And if you get it older, you're going to pay more each month, but for a shorter period of time. So I think it's an important piece to our financial wellness and planning to look at and put in place. And I have a resource for that in another slide. Dallas Duche is an expert with long-term care insurance. She's who reviews my policies. I've sent many families to her to review their policies, and she can also help you choose the right policy for yourself. again, Medicare on here is a resource and a benefit. We've all been paying into Medicare, and it is for health care. But however, it is not for long-term care. It is that episodic care. Veterans Administration, which is what this VA stands for, not virtual assistant, it's Veterans Administration. And there are two benefits that veterans have available to them. One is financial qualification, and one is service time qualification. So I'm not an expert on that. I know that they're available, and the VA is doing a better job at marketing those benefits to veterans, but they didn't for a long time. So your loved one might not know about them, but there are people who can go into detail about the VA benefits. We've talked about the long-term care insurance. Chris, was sharing that when we get those policies, it's important to ask them and specify whether we want home care, assisted living, skilled nursing care, and all of that included in the policy. The old policies were sold as nursing home policies. Well, who wants to go to a nursing home? Nobody. So they didn't buy them, first of all, but those who did have a little foresight bought nursing home policies, and they only pay for skilled nursing communities. So advocating for somebody to think broader when they're looking at long-term care insurance policies is very important. Chris, do you have anything to add to that?
Yeah, I want you to remember the slide because we're going to go here, we're going to move a little faster, but we'll go through some costs later. But the clear piece I want you to take away from this slide is when it comes to living expenses, Medicare does not give you any living expenses. They pay for episodic care. Medicaid waiver living expenses are really low and traditionally end up in situations that none of us want our loved ones to be in. That's being very candid. Long-term care insurance does not apply to assisted living, home care, in-home care, unless it's in your policy. And then VA has a program called Aid and Attendance. There's a company here locally called Patriot Angels that helps VAs, and it's for VAs who are vets who served in wartime or their spouses. That does pay for some living services. Beyond that, it's private. And so that's a key thing that you have to understand. And so looking for insurance policies that do cover assisted living, memory care, or some in-home care are really important if you want your loved one to stay in that setting and not end up in skilled nursing. Or thinking Medicare is going to pay for any of that, or Medicaid, they will not. So it is a private situation right now currently. Some of this is shifting, coming with value-based care. That's a whole other exchange. But right now, you have to have the private funds or some other mix of funds to go through and to pay for services.
And I will elaborate a little bit more on Medicaid services. So if there is a need to spend resources down to qualify for Medicaid, then if you are going to need to move your loved one into a facility for that Medicaid provision, you can buy your way in, then you get a choice of which facility you go in. If you wait too long and it's on an as-needed basis, if there's a hospitalization and a crisis and they need to place your loved one in a Medicaid facility post-hospitalization, the only beds open might be 25 miles away or 50 miles away.
Yeah.
So being proactive with this, again, is imperative. Some of these things are imperative that we think ahead on. What?
I was gonna say, for the sake of time, I put up the care continuum slide. I want to make sure we stay on track.
Oh, okay. All right. Yeah, we're over 9:30.
Yeah.
Okay.
So this is this slide. We're gonna go a little bit more into this, but we'll share this presentation. But just kind of this slide walks through, the types of care, function, and settings, and then some of the cost dollars. I have another slide that shows actual cost dollars. We'll go through really quickly.
Yeah.
And then
next
the sources
slide.
of funds.
We want to get to your questions.
Yeah. Do you want to hit this real quick, Elizabeth?
I will. So again, Medicare does not pay for long-term care insurance, long-term care. extended care services. That is a private pay play. Medicare is short-term episodic care for those specific services there. Hospice is another benefit that Medicare does pay for. And it's a wonderful benefit and great services. And yet you have to have a terminal diagnosis of 6 months or less to qualify for hospice. Now, people can live more than 6 months. My mother lived on hospice for 2 years. And it's because of the support and the love and the care that she got, she felt better. But they kept requalifying her because technically she had that diagnosis that it was terminal within 6 months or less. So we've talked a lot about private pay and out of pocket. You can see there's broad ranges in these costs. So it's determined by what your resources are and your area and the amenities provided and so forth. The in-home care, $31 an hour to $60 an hour. $31 an hour is a level 1 care, which would be light housekeeping and really no personal care. No individual, hands-on physical care. That's standby assistance. You might have a home health, aide that would do that, but no bathing, no dressing, no hygiene, no dementia training. And then it goes up from there. The $60 an hour is, I know somebody locally who has a niche service that provides mainly dementia care for short term, like 2 hours at a time or 3 hours at a time. It's very social, very engaged level of care. So it's a niche service, boutique service. You can find the cost in your specific area by going to this Genworth calculator link. It's valuable, extremely valuable. And Chris can talk more to senior living communities. I know what some people are paying. My clients are paying for assisted living, but this is your wheelhouse, Chris. Do you want to talk more about that?
Yeah, I'll take that from here. We've covered some of this, but just real quick, and like I said, we'll share. This is just kind of the age bracket of where people are when you start to move into the housing setting, right? Active adult, no services, more like your multifamily apartment. Independent living is, some services, activities, and meals. Assisted, you start getting into some limited care. Memory care is cognitive, and then full nursing, and just kind of the costs increase and as ages increase, as everyone would expect. This is what each service, I went through this really quickly. This graph just demonstrates what each service has. So your active adults more what they used to call 55 plus, but trust me, we have several of these properties. Nobody 55 is living in those. That'd be 2 years away from me, and I don't see myself there. So it's usually about a 75-year-old that's really looking for a lifestyle and wanting to be around people their own age and have more of a lifestyle play. Independent living are folks that aren't looking for necessarily care, but maybe know they have maybe a diagnosis or something coming. And so it's more of multifamily with usually you have 3 meals a day, some limited activities, some social engagement. Assisted living starts to move you into the healthcare where traditionally there's nurses on staff. They're not there to treat, they're there to observe and to help support. You have caregivers, private, similar to what private duty home, you have private duty caregivers at the community. They're helping with showers and bathing, helping people with medications, where you start getting to the service component. And then memory care is same as assisted living, but it's cognitive support. Obviously, someone who starts having dementia, anyone on this phone call has had a loved one that's gone through that. Folks with dementia they get agitated. They tend to sundown at certain times. They start to maybe elope, meaning they not get married, but they go walking and they find them 5 miles away from home. And so those neighborhoods tend to be really specified in how do you treat folks who have memory impairment, keep them engaged and keep them safe. And then skilled nursing is what we all, most of us have probably thought about as the nursing home, where it is more, you have nursing treatments, things happening there. For acute and things needed that are emergent, nursing homes are great, but for long-term living, they're not fantastic. These are your costs. Active adult ranges between $2,000 to $2,500 per month. a little bit premium to multifamily. Independent, you get more into the 3,000, even as up some independent, luxury can get much higher, but that start around that $3,000 a month phase. Assisted living, 4,500 to 5,000 is the average per monthly cost. So you're looking at like a $60,000 annual cost for that. Now in that, you've got meals, laundry, support. There's a lot of services. Memory care gets more expensive because of the intensity of what's needed. Usually you have higher staffing ratios, meaning you have more staff to care for residents. You have more intensive programs to help people engage. And then you look at the nursing home costs, they're significantly higher. There's a huge jump. Now, there's a lot that can be done if people get into the system sooner, and a lot that can be handled if we get these cheaper realms. And I think sometimes people see the monthly costs and get sticker shock. But if you take $5,000 a month, it's about $150, $170 a day, less than what most of us pay for a hotel for a night. And if you think about all the services there, Elizabeth showed this, the cost of private duty home care, $30 to $60 an hour. This is a more cost-effective benefit than in-home care if you can't afford it. But you do give up some of the choice and some of the independence that people have at home. Just these are what the communities look like. I think sometimes people still have this image. I'm shocked that they still have these images of like, One Flew Over the Cuckoo's Nest, nursing homes, or things you see in movies. These are some of the properties that we have built or we own across the country. And, they're high end, they're nice. There's different levels, but they're very much, this building at Huntsville, Alabama looks like any nice new multifamily apartment complex you went in with golf simulators and putt-putt greens, swimming pools. And so there's a number of different amenities that are available, but we really kind of following this student housing play of create some amenity-rich environments. We'll never be someone's home. I tell this all the time. I coach my teams. Trying to tell an older adult they're moving home when they're moving to our communities is wrong, because they're homes where you raised your kids, where you had your life experience, where you have these memories. What we're trying to create is a great experience so as people age, they find a place where they really connect with people, but they also can enjoy life. They're all going to have healthcare issues. As we age, we all have them, but we try to put the healthcare behind the scenes and really focus on the individual to create a better living experience. And these are just some of the things that we do, and you can find these on if you go to our website, you can get them at any senior housing website that will just kind of the services that happen within community-based settings. And then this graph just kind of demonstrates, these are the things, the blue are the things that can happen in a senior housing community, the private duty home care, nutrition support. All of our communities have some culinary program, restaurant style dining. That personal care, right, helps with not just ADLs, but caring for a pet, things of that nature. The social support, I spoke earlier how important that is. Isolation for older adults is really detrimental, mentally and physically. And so what I loved during COVID, I didn't like much during COVID, but in our communities, people were still connecting with one another. And that we have stories after of folks that weren't in community-based settings that lost a lot of ground in their personal well-being because they were isolated. And then managing household expenses. Managing a house is tough, especially tougher as an older adult. And that kind of comes in the program of senior housing. The green are all things that are outside, but a lot of, like our organization contracts with top providers in these areas to help support, whether it's Part A home care to come in and take care of something that's episodic. Elizabeth mentioned hospice. If your loved one has a terminal diagnosis, they can be in hospice long before they're actively dying. And hospice is an incredible service paid by Medicare that can really help people age and live whatever time they have left very gracefully and very peacefully. And so I think sometimes people are scared of hospice because it's end-of-life care, but it really is a way to create a service and use their Medicare benefit in a profound way that makes an incredible impact. Hospice employees are some of the most giving, caring people on the planet. So don't be scared of that. Rehab, pharmacy, Elizabeth mentioned technology. We use fall detection technology that's video-based and AI-driven in our memory care neighborhoods, and we've seen a reduction in ER visits by 62%. So there's a lot of things we're employing in the senior housing world that help improve outcomes and hopefully give your loved one a better living experience. It'll never be home, We'll never get over that, but it'll give them a chance to stay social, stay connected, and hopefully age well. And we talked about a lot of this presentation, a lot of negatives on this, but it's just the reality of what it is. And so this last slide, I wanted to represent, these are real people. We don't, in my website,
Chris?
we don't, yep.
Before you do that, can
Sure.
I add something to the hospice? There's a new service
Please.
called End of Life Doulas. And it's
Yes.
many people know about mom doulas. I am getting certified as an end of life doula because I love helping people plan for the end of life before it's, happening. And that is what people tend to not want to admit into hospice for, because they think that end of life is imminent. But hospice helps people live, until they die. End of life doulas help plan for end of life. Who do you want around? What music? What environment? What, all of that before that imminence comes. So it's a great partnership with hospice when that need is there.
I'm so glad you brought that up, because I'm not sure if she's on, but I'm going to give her a plug. One of our members, Judith Bright, who's also my SAP co-chair, is an end of life doula. And if you know Judith, she's amazing. And so that's another great service that's come around here in the last several years that I think, because to Elizabeth's point, when you're in that end of life moment, really planning and making that as dignified as possible for your loved one, I think is really, really important for their experience and yours, right? As you go through the grieving process. So if you have any questions on that, Elizabeth obviously is a resource, but then Judith Bright as well. Okay, and then just, like I said, these are all real people. We like to celebrate life in our communities. You'll go to our website, we never use fake pictures. These are all folks just having fun. And so I just end on this. Aging is not a prison sentence. It's not a death sentence. We're all going to do it. This whole series has been about how do we age better. And even when you get to the point where you do need more care and you maybe can't stay at home, there is still great opportunity to live well in certain settings and enjoy life. And I just, please remember, just because someone's 85 doesn't mean they don't want to go to a senior prom. That's what the picture in the middle is. Doesn't mean they don't want to have a little fun and enjoy life. It doesn't mean they still don't have the same wants, desires that we all have. And I think just remember that and embrace that. Aging and dealing with the process of aging and all what it brings can be extremely frustrating and exhausting. But remember, people just want to be respected. They want to live with dignity, and they want to be treated with, respect. And so don't forget, our older adults deserve that. So let's try to be as graceful as we can when we work with them as well.
And it's a much better journey when we have all of this support in place and we put it in place proactively rather than reactively. Mm-hmm. Thank you for letting us talk about all this.
Your passion is impressive and very much appreciated. You guys put an awful lot out there that's very informative. So questions, please put your questions in the chat. I have a follow-up question to something that Samira put in there. My mom is 92 and I'm concerned, about falls, and we try to encourage her to keep her phone with her at all times. But I did not know that an Apple Watch can give an alert for a fall. Mm-hmm. Is that an app? I've got an Apple Watch on right now. Is it an app you have to add? Can you give us a little bit more on that?
I'll let Samira, I'm not an Apple Watch guy, I'm a Garmin guy, so I'm gonna let Samira handle that question.
I am not positive, but I'll find out and let you know. It was something super easy that he downloaded, and he lives in a small town, so like the sheriff is on his list and the neighbor across the street, and we are as well. He did fall once and it worked like a dream.
Wow.
It really did.
Yeah, I don't think it's a separate app. I think if you just go into your iPhone and look at your watch settings, you can find that section and have it alert who you want.
Yeah, I think it's a setting you click in your Apple Watch, and probably the health aspect. Now, it can be sensitive in the beginning. I think it learns with the individual person. So test it a few times.
But that's a great simple way to start, just opening up a discussion, right? If you're seeing falls happen, it lets you start having those conversations. And there's a bunch of technology, David, that can support in home. fall detection. So we can offline if you want to have a conversation with that too.
Yeah, and that link that David just put in the chat is perfect.
Thanks, David.
Yes. So there was a question about crypto and how to make sure that somebody knows how to access your crypto with crypto over 100 grand now. It's a good question, but probably not one for our two experts today. But maybe we can have somebody follow up with that one. So it was unintentional, but my 92-year-old mother has been socializing with her friends, and in the process has gotten to know a lot of their caregivers, which gives me comfort. Again, it was not intentional, but maybe it should be intentional. When she goes to lunch with her friends, their caregivers go. So for the last 10 or 15 years, she's been getting to know a lot of caregivers. And again, it's a great comfort to me, but and it wasn't intentional, but maybe it should be intentional.
Well,
if
I
you
would
guys
say
have any-
that she is getting the care of those caregivers, however unintended, right? Because that support is there, and a caregiver at heart is going to do whatever they need to do with the person they're around that needs it. So she probably is getting some support from those caregivers. Now, also, friends become caregivers in many situations. I recently worked with a family that she was still in her home, and every day they had cocktail hour, and the group of them would join together. And one of the friends in the neighborhood became her eyes and ears for the family, basically. But they knew that that was getting a little stressful for the friend. So she has since moved, and that friend was actually relieved. So I think it goes back to having the conversation sooner rather than later, and just learning where they are with that support that you are seeing that they have.
Yeah, my comment on that, little cautionary but advice is, we unfortunately as adult children, we end up becoming kind of the parents for our parents at times. And I think if you think about when you have teenage kids, you want to get to know their friends, right? So you can find out and understand what's going on. You should know your parents' connections, because they will tell you more about what's going on with your loved one than your parent will. I think in your situation, David, that I'm really glad to hear that your mom has developed a relationship with caregivers. If you decide to bring in-home care, that's finding people your loved ones connect with is really important, because we're all humans, right? Sometimes we just you bring some in, people don't connect. So if you do try in-home care and your mom or your dad doesn't like the person coming in, that could just be a personality thing. Don't give up on home care. Just try to find a caregiver that does connect, because you'll see a lot of people in our industry that Elizabeth and I are in, they're in it because they're mission-driven people. And so they do care. And so they want to connect. They want to develop relationships. And that's something you should encourage, because the more socially connected our loved ones stay with people, and building new friendships is something we all want, can be helpful. And it also makes the caring process easier.
And if and when you are thinking about home care and wanting to interview home care companies, that's an important component, is to ask how they match the caregiver with the client, because it does need to be an engaged friendship of sorts. And the activities that your mom is interested in needs to be something that the caregiver, plays an interest in.
Well, like Samira, my mom's in a small town, so the phenomena has been, as her friends have passed on, those other people, within that circle know those caregivers, and they typically move on to somebody else in that circle. So it's to me, it's the comfort that she knows a handful of people who are options when she inevitably gets to that point, that she already knows them pretty well. And, it's pretty good chance that she's going to take on one of those caregivers when that time comes. To me, it's again unintended, but intentional. Maybe it should be. Right. So David Fredrickson's also put in on the link a link to a file box for storing critical information, financial information that's safe. So thanks, David.
Thank you.
Other questions? I'm not seeing any right now, but I'm going to put in a plug for our one-on-one connection. I actually knew that Judith Bright was a end-of-life doula because the EO and one-on-one connection, I thought, what an incredible service she provides.
Mhm.
But definitely a plug for the one-on-one thing. I've enjoyed it thoroughly. Guys, I'm not seeing any other questions, and I'm looking at my Apple Watch, and it's 10 o'clock. I've learned an awful lot and have thoroughly enjoyed this presentation and really appreciate you guys' passion and the knowledge you bring. Because I think I may be the most senior person on the call right now, but it's coming for all of us, and this is very helpful, and we really appreciate it.
A pleasure. Thank you. Thank you, everybody.
Thank you guys so much.
Thank you.
Yes.
Have a great day.
Take care.